It's a very good day and welcome to Surviving COVID featured on Asake Online. My name is Sizwakele Ndlovu and on the show today I'm going to be chatting to Dr. Edwin Sibanda and he is the Director of Health Services Department in the City of Bulawayo. Good day, Doctor, and thank you for gracing us with your presence on the program.
Good day, good morning.
So, sir, we wanted to find out from you, Uti. We've seen the vaccination program, Bulawayo and countrywide, going through various phases. Would you like to take us through which phase we are in now?
Thank you for the question. The vaccination program was initiated in February and it started with the essential services, mainly the frontline workers. And these included, amongst others, the healthcare workers, the nurses, the doctors, the other caterers such as laboratory staff, physiotherapy staff, health promotion officers, environmental health officers, etc. That is the healthcare workers. We had the port health workers or the customs workers such as Zimbabwe Revenue Authority workers, the security sector, and later on we included the teachers, the judiciary, or even the National Prosecuting Authority, and more groups were added onto the list. And ultimately, we moved on to the informal traders, and the informal traders and the elderly and those living with chronic conditions. After these groups, the program was then open to everybody 18 and above, Zimbabwean, willing to have the vaccine for free, and it was still voluntary, and it is still voluntary as we speak.
Okay. So what has been the response from the public so far?
I would say the healthcare workers and the rest of the frontline workers were fairly hesitant. The uptake was not as good as we projected, but as we were proceeding with the vaccination program, we entered the second wave, and this really created a bit of panic amongst a lot of people and pushed people towards the vaccination points, as it were. And ultimately, by the time we got to the last group where we are saying it's open to everybody, we are now seeing close to what I can call a stampede. The health care centers can no longer cope because the numbers can be anything up to 500 at a particular institution. Even if the teams are good, many, they are fast, efficient, etc., it's very difficult to finish all the people that come forward looking for the vaccine. We are seeing even young people, even people sleeping at vaccination points. Yes, we have got the curfew. Now we're in the third wave, or probably in the tail end of the third wave. And the third wave has killed a lot of people. I remember the saying that when the COVID-19 started, especially the deaths, it was numbers. And ultimately the numbers turned into names. And those names became people that we knew. And some of them became our relatives, our close workmates, associates, etc. And people are now realizing that I've buried a friend, I've buried a colleague, I've buried a relative, a parent, etc., or even a neighbor. And now people know that COVID is there and is real. So we are seeing a very, very, very good response now. Yes, it is overwhelming the healthcare system, but it is not it is not like unmanageable. So we feel that the opening up of the private sector has assisted or will assist as we go forward.
What has been the public's response to masking up? We've been seeing this mantra from February last year. Well, even beyond that, say mask up, social distance, stay at home, sanitize. Are we adhering to all those things, or we've just become immune, or we're still maintaining all those regulations that were given to us?
The regulations have not changed and will not change as long as COVID is around. We may move from the alpha variant, go through all the variants until we get to the omega variant, or literally finishing the Greek alphabet. But the methods of prevention, the message about prevention remains the same. Keep your distance, mask up, and sanitize, wash your hands, and stay at home if you don't have anything to do within the city center or travel unnecessarily, as it were. I would say the community has not responded as well as it should or must or is expected for various reasons. First, the risk perception. People believe that they are not at risk of COVID for one reason or another. It might be because, no, I think you are too far away, or no, there's no COVID these days, the numbers are low, or it might simply be because, no, maybe the mask does not work, no, I washed my hands earlier, etc., and lots of other things. And people think that, okay, maybe I don't have to put on a mask. Then the sanitization itself. People, I don't know whether they get tired or they don't think it works or they don't like it at all. But ultimately, people are not sanitizing as frequently as they should or as thoroughly as they should. I've seen people get a drop of a sanitizer at supermarkets or other places where at entrance points people have to apply a sanitizer. And all they do, they apply in one hand and just shake that one hand and proceed and get into the institution, which I think, to me, is saying the sanitization process is either useless or unnecessary, or it's an inconvenience. Maybe like people are getting tired, maybe, but there is also there are people who are daring, the daredevils, where people want to, stretch their luck to the limit and see whether, look, and come back and claim that they are heroes. I did not put on a mask, I did not get vaccinated, I did not sanitize, and I survived COVID. There are people who probably want to go that route and one day tell us that those of us who are putting on masks and keeping the distances, sanitizing and all, maybe are cowards. So there's that feeling as well, that maybe there's that group of people, Yes.
You just want to break the rules, as it were.
Yes, they want to defy authority. And they pride themselves in defying authority. Everything is yenza, I think there's that group.
Okay. Coming back to the vaccination process, what are some of the symptoms, and what can people expect from a vaccination program or an exercise like this? Because we are hearing quite a few people who are scared of actually coming through to vaccinate because makhelwane wami wagula and things like that. So that information to say, look, when you vaccinate, there could be some reaction to it, and what are some of the reactions that you can expect?
First and foremost, before vaccination, it is advisable that people must make sure they are well on the day of vaccination. Because if you go to a vaccination point and you are feeling unwell, it will be very difficult to tell whether the vaccine made you worse or caused you to feel unwell. So people must know that they are feeling healthy, feeling all right on the day they go for vaccination. And when they do get the vaccination, they must watch out for the following. Flu-like symptoms may be there, but very mild, because we're introducing an attenuated virus, meaning a virus that has been killed into your body. It will not multiply, but the quantity will be so small that even if we had introduced it to you dead, it will not cause you to have symptoms. We're asking your body to recognize the virus, mount a response to it. And in mounting of that response, the body may behave as if you have a milder form of the COVID-19. A slightly congested nose may be there, maybe even a small headache here and there. And even if a low-grade fever may also be expected. But it's not always there. There is the vaccination side. A very, very small percentage of people may either have pain at the vaccination site or bleed from the vaccination site. But our nurses are trained in such a manner that most people will not even remember that the pain of being vaccinated. That they will actually tell you that I did not feel any pain. That is the majority of the people. And the other symptoms that I've outlined before may then follow within a period of 14 days. They will not be like immediately you are injected, then your nostrils are blocked and all that stuff. That is unlikely. You will have it within a period of 14 days. And that is even of the second dose, when your body is now familiar with the virus and you are getting a booster dose, if it is the Sinovac and if it is the Sinopharm in 28 days, then we are then expected to feel the same symptoms and feel them differently. Again, let me hasten to say, because one has been vaccinated, it does not mean they are no longer going to have any other diseases, because this vaccine is targeting only COVID-19. Malaria is still going to be there. We are still going to be unlucky to drink or eat contaminated food, and our tummies may ache and start vomiting and things like that. So people still have their blood pressures, their blood sugars may still go up or down. All these things may cause one to feel unwell. So we must be very careful in history taking, but we should report to our nearest health centers when we feel unwell post-vaccination, so as to enable healthcare workers to tease out what may have caused the person to feel unwell. If it was vaccine related, they still document it, and the team of experts will then look at the evidence before them and the information and make a determination that the feeling of being unwell was or was not vaccine related. There is that report, is called Adverse Events Following Immunization. A specific form is designed for that, and it applies to all vaccination programs, be it the under 5s or any other vaccination. And it is mandatory that healthcare workers report on that, such that a team of experts evaluates the evidence before them. And more so for the COVID-19 vaccines, which in themselves are still licensed for emergency use, meaning that some of the side effects that may occur have not been documented. And in so doing, we may then create that body of evidence which may form part of the advice or list of side effects that are yet to be discovered.
In light of that, would you say it's necessary to get your COVID test before you get vaccinated?
It would be ideal that we all get a COVID test before we get vaccinated, but some people, for one reason or another, may not have ease of access to vaccination, to testing prior to vaccination. But the ideal thing is that anyone who has COVID, suspects to have COVID, or is known to have COVID, must not be vaccinated. And after the symptoms have disappeared, they must stay up to 30 days or a minimum period of 30 days before taking their vaccine.
Okay. Dr. Sibanda, we have so much information going out there. We've got infodemics that are flying around. We've got WhatsApp messages that are talking about COVID-19 symptoms and statistics, where can we look to for credible information, reliable information that from the various sites?
Infodemics, unfortunately, have been there on all subjects. I'm sure even in soccer, we've had prophets predicting score lines of matches. To me, they are part of that infodemics. And unfortunately, even in COVID-19, as a disease, from its origins, symptoms, causes, or even its existence, we have infodemics. We now have a vaccine, and what it does, what it is made of, made from, and by who, for what purpose. We have infodemics discrediting or distorting the information about these issues. People must not look to social media and newspapers in general for all information, but there are websites for genuine and credible organizations. We have the World Health Organization, WHO in short. We have got the Center for Disease Control under the American government system. We have got the Ministry of Health in Zimbabwe, locally, the Medicines and Control Authority of Zimbabwe, MCAZ, which licenses these vaccines. They all have websites and they can be relied upon. And the City of Bulawayo also has a website. And all these sources can be looked up to, and questions can be posed on these websites and responses given. Whereas on WhatsApp, it tends to be a one-way, or should I not to single out WhatsApp, but on social media, the information tends to be one way, and there's no one who posts their number to say, okay, in case of any questions, please call this number or send an email to this number. Because you can't have people who are anonymous sending out information that has got an impact, such as people not taking the vaccine or taking the vaccine. I think we need to rely on credible sources, and I would encourage all media, social or otherwise, to stick to the truth, because with the truth, you don't have to remember anything.
Pertaining to the vaccination points that we have across Bulawayo, where can people get vaccinated, and where can they get information as well about which way to go to for such?
In terms of information as to where we can get vaccination, we have, as City of Bulawayo, in representing and working with the Office of the Provincial Medical Director and the Provincial Task Force, we have got a rapid response team. In that rapid response team, the numbers can be shared, and they are there within the website of the City of Bulawayo, and people can then ask as many questions as they want on those numbers, and leave them some of the questions on the website. But in short, let me say, the city has got 19 clinics dotted around, and most of them are within walking distance of residential areas. And all these clinics are offering the vaccine, both dose 1 and dose 2, depending on what phase we will be in. We also have the central hospitals, 3 within the city, Mpilo Hospital, United Bulawayo Hospital, as well as Ngucheni Referral Mental Hospital. We have got the National University of Science and Technology. We have got Ekusileni, JMN Komo Ekusileni. We also have Sima's Clinic in First Avenue and Jason Moyo. When we have Vivat Clinic, run by Bonvi Medical Aid at Zimtef. It also offers vaccination, and these sites are free. We recently allowed or started working together with private for-profit organizations, health facilities, So far, 14 have come forward and started vaccinating, and the list will be shared on this website, on our website, and as frequently as possible. And from time to time, we'll be sending out messages to the press and even our Twitter handle, our WhatsApp, etc., to make sure that as we update this list, because there are others who are literally knocking on the door and have sent their applications, and as soon as they are oriented or trained in issuing these vaccines, they'll be added to the list. But these ones people must expect to pay. The amount is prescribed by the Ministry of Health as 440 Zimbabwean dollars when injected by a medical officer, and 220, which is about 50% of the earlier amount, when injected by a registered general nurse. This one is payable to the practitioner there, and yeah, I think this is, in short, how people must expect to access the vaccine, especially those that are unwilling to stand in a queue at the public institutions.
Thank you very much for that information. Any last words for our viewers?
My last words would be simple. COVID is there. COVID is real. COVID kills. Masks will prevent, if all of us put on masks, we will prevent COVID, or the amount of COVID in the environment, the viral particles in the environment. If we keep our distances, we are unlikely to spread COVID or contract COVID from someone who is more than a meter from you. If we stay at home when we have nothing to do, COVID will not come to our homes. We don't need visits, or we don't need to visit anyone. Social media, which we love so much, has made it easier. We can even share a funeral via Zoom. So people don't have to gather for a funeral. Ask yourself, if I did not attend this particular gathering, what would happen? Would things be different? Would they turn out to be different? Because people are gathering at funerals, they want to come even to the cemetery for someone to whom they are not even related. We are very worried. Yes, they are allowed to gather up to 30 people at funerals according to the law, but we are seeing far more than that. And we tell them that at cemeteries we want 30 people. And you see 30, maybe 100 people come into the cemetery and only 30 want to come in. What are the 70 doing outside the cemetery? Let's stick to the 30 at home, 30 everywhere, 30 even in the cemetery. We can still share the grief even online. We can share the happiness online and everything. I think social media has made life easier. It's the new normal. It will pass, and when it does pass, we can resume our lives as we used to. Yes, they will have been modified because we may have lost loved ones. We will also acquire new cultures, and we'll know different ways of doing things, and then we'll probably be better people as we come out of this. Thank you.
Thank you so much, sir, for a very informative discussion with you.
Thank you.
That was Dr. Edwin Sibanda, and he is the Director of Health Services Department in the City of Bulawayo. And remember, there are more than 20 places. There are 19 clinics where you can get your vaccination. You can get it at the hospital, and there are 14 private players that are set to come in and ease the congestion. So there is no excuse for you to not get vaccinated. And please remember, we've been singing this song throughout. Mask up and wear your mask properly. So many people are wearing masks, and the masks are barely covering their noses, or not even covering their mouths at all. So if you're going to mask up, please mask up and mask up properly. Remember to sanitize your hands and maintain social distance. That's all we have today on Surviving COVID. Thank you for watching Asake Online. My name is Sizwakele Ndlovu, and I look forward to meeting you in other programs. Bye for now.